Hello friends, I am Professor Smita from the Department of Humanities and Social Sciences, IIT Roorkee, and I'm working on the course Health and Disability in Humanities. And as we are doing literature and medicine as part of this course, literature and medicine, as I said earlier also, that this is one of the very important aspects of medical or health humanities. And we have discussed in detail some of the literary pieces dealing heavily with medicine and the significance of medicine. So, in this process and in such context, we may name John Keats, whose poetry is full of medical imagination. So, John Keats, whose date was from 1795 to 1821, was an accredited apothecary surgeon who spent more of his adult life practicing medicine than writing poetry. Though he famously abandoned the hospital for the frivolous life of literature, his medical training at Guy's Hospital 1815-1817 and 5-year apprenticeship under Thomas Hammond provided the visceral anatomical vocabulary that defines his greatest works. Well, we should look into his poetic imagery and the influence on that. So, Keats's medical imagination allowed him to describe the human body with a clinical, unvarnished gaze often absent in other romantic poetry. Some of his influences on poetic imagery are pathological precision. In the poem Ode to a Nightingale, he describes the progression of tuberculosis, the white plague that killed him and his brother, with anatomical accuracy, where youth grows pale and spectre thin and dies. Pharmacological knowledge, his poems frequently reference specific medicinal plants like hemlock, foxglove, and ulsbane, reflecting his expertise in compounding drugs. The poet physician, in his epic The Fall of Hyperion, Keats explicitly links his two vocations, famously declaring that a poet is a sage, a humanist, physician to all men. Now, let us take a look at how medicine and poetry are intertwined in his poetry. Keats did not leave his medical knowledge behind, but rather transformed it into a new type of poetic sensibility. First is physiological imagery. His work uses anatomically sharp imagery, such as in Ode to Nightingale, as already discussed, where he writes of a world where palsy shakes a few sad last gray hairs, where youth grows pale and a spectre thin and dies. Then the melancholy fete. Keats's poem Ode on Melancholy displays a deep understanding of pharmacon, the duality of toxins that can heal or destroy, mirroring his pharmacological knowledge. Third is negative capability. This concept, living in uncertainties without irritable reaching after fact, mirrors a physician's ability to observe suffering without needing immediate answer. Physical suffering in verse, in Isabella or the Pot of Basil, he depicts the decomposition of a body with a striking accuracy, merging romance with the wormy circumstance of death. The important narrative include medicine as soul-making, life as suffering. Keats termed life as a veil of soul-making rather than veil of tears, believing that experience, pain, empathy develop the soul. Poetry as therapy. Keats viewed his own poetry as a palliative design to pour out balm on a troubled, suffering humanity. Physician to all men. In The Fall of Hyperion, he defines the poet not as a mere dreamer, but a chaste and humanist who heals humanity's wounds, in direct contrast to the dreamer tribe who only vex the world. Thus, the evolution of field of literature and medicine has been marked by a shift from descriptive work to analysis, such as scholars less interested in how literature reflects medicine than in how it can be used to dissect, critique, and strengthen medical epistemology and practice. Moving forward, a recent review of contributions of literature to clinical practice made a compelling case for the future of literature and medicine. While continuing to value the depiction of patients' and physicians' lives found in literature, the field is further strengthening its concern with narrative ways of knowing and their applicability to ethical problems. These emphases help practitioners develop important skills in communication and moral reasoning. Likewise, literary and narrative analysis help attune readers to the richness of context and the nuances of everyday clinical, personal, and professional encounter. Just as medicine and medical education have been moving towards more humanistic concern, scholarship in literature and medicine has been incorporating more analytical method. Paradoxically, though, as the techniques of literary criticism become increasingly important, making literature more useful to clinical practice, the joys and intangible pleasures of reading remain. As an art form that enriches many facets of human experience, literature cannot be reduced to a tool of analysis. Rather, the written word has an inherent and often inexplicable power. The continuing engagement of two exciting, enriching, ennobling professions bodes well for our hope of celebrating with a wide audience many anniversaries of the strange marriage of literature and medicine. Well, importance of literature within the field of medicine. So the vocation of doctors is to care for patients. Nevertheless, the frequent dissatisfaction of patients points more to the human deficiencies of medical professionals than to their technical shortcomings. Complexity comes mostly from patients, not from disease. While technical knowledge helps in solving disease based problems, the patient affected by these disease remains a real challenge for the practicing doctor. Literature helps us to explore ways of being human, grants glimpses of lives beyond our own, aids empathy with others, alleviate distress, and widens our circle of awareness. The same could be said of clinical practice in all of its manifestation, nursing to surgery, psychotherapy to physiotherapy. And awareness of literature can aid the practice of medicine, just as clinical experience certainly helps in the writing of the book. The two disciplines thus have more parallels than differences, and I would like to argue that they share a kind of synergy. For instance, there are unconscious processes beyond language that occur in practitioners' brains as they approach patients. The many thousand-year multicultural medical terms practitioners use contribute to influencing the way they view disease. However, this affinity of the practitioners' use of words and language in medical encounters can draw them to literature and writing. The stories patients tell themselves about their illness are a critical link connecting them to the doctors. Thus, there are parallels between generating and appreciating lasting stories and art and generating and appreciating healing therapeutic encounters. Both are helped by adopting the same attitude of open curiosity, of creative engagement, of seeking to empathize with the predicament of the other, of tapping into the wider context of human lives. The doctor, like the writers, works best when she is alive to the subtlety of individual experience and is able at the same time to see that individual in his or her social context. Moving forward, let us now discuss how ancient Indian literature is also related intricately to the field of medicine. So ancient Indian literature and medicine were deeply intertwined, with foundational medical knowledge recorded in the Vedas and systematic treatises, that is, Samhitas. The Atharva Veda, 2nd millennium BC, is the earliest documented source of medicinal plants and hygienic principle, while the Charaka Samhita and Sushruta Samhita, 600 to 200 BC, formed the core of Ayurveda, covering diagnosis, internal medicine, and advanced surgery. So let us know the key aspects of ancient literature medicine intersection. So the Vedic foundation, the Atharva Veda, includes early concept on longevity, herbal cures, and the eradication of germs. Medical specialities. So ancient texts detailed 8 specialities, including pediatrics, geriatrics, mental health, and surgery. Surgical advancement. Sushruta is considered the father of surgery, detailing techniques such as rhinoplasty, plastic surgery, cataract removal, and wound stitching. Diagnostic techniques. Physician used all 5 senses for diagnosis and developed the Thidosha theory, Vata, Pitta, Kapha, to maintain bodily balance. Anatomy. Knowledge was derived from careful observation through religious prohibitions, sometimes limited human dissection. The great trilogy, Samhitas, the Chakra Samhitas, general medicine, internal medicine, and the Sushruta Samhita, surgery, are the most significant texts, with the Ashtanga Hridaya of Bhagavata also providing key insight. So let us explore about Charaka Samhita and Sushruta Samhita in greater detail. So the Charaka Samhita, 100 BC to 200 BC, is the foundational Sanskrit text on internal medicine, Kaya Chikitsa, and is considered one of the most authoritative works in Ayurveda. The text is built on the Tri-Sutra framework, which organizes medical knowledge into 3 pillars: Hetu, etiology, causes of disease; Linga, symptomatology, signs and symptoms; Aushadha, therapeutics, treatment and medicine. It also establishes the 3 dosha theory, asserting that health depends on the balance of 3 bodily humor: Vata, that is movement; Pitta, metabolism; Kapha, stability. So, a structure of Samhita, the work is divided into 8 sections, that is sthanas, and 120 chapters containing over 9200 verses. Sutra Sthana, fundamental principles, philosophy, and healthy living guidelines. Nidana Sthana, pathogenesis and the causes of major disease. Vimana Sthana, medical training, ethics, and specific factors like diet and test. Sharira Sthana, detailed study of anatomy, embryology, and the metaphysical nature of the body. Indriya Sthana, diagnosis and prognosis based on sensory responses. Chikitsa Sthana, extensive therapeutic methods and medicinal formulations. Kalpa Sthana, pharmaceutical preparation for detoxification. Panchakarma. Siddhi Sthana, practical mastery and successful execution of treatment. So the key contribution of Charaka Samhita to medicine is the holistic health. It views the individual as a triad of body, mind, and soul, emphasizing that health and disease are not predestined but influenced by lifestyle. Medical ethics. It provides one of the world's earliest codes of ethics for physicians, mandating patient privacy, compassionate speech, and informed consent. Then preventive care. It stresses the importance of daily dinacharya and seasonal ritucharya routines to prevent illness before it occurs. Anatomy and physiology. Charaka describe the digestive system, metabolism, and immunity, and even estimated the human body to have 306 bones, including teeth. Then Sushruta Samhita, that is 600 BCE, was a legendary physician and surgeon of ancient India, globally celebrated today as the father of surgery and the father of plastic surgery. He practiced and taught in the holy city of Varanasi, Kashi, and authored the Sushruta Samhita, one of the most important foundational texts of Ayurveda. So the key contribution to medicine of Sushruta Samhita is the first plastic surgeon. He pioneered rhinoplasty, reconstructing a broken or severed nose by using a flap of skin from the forehead or cheek, a technique fundamentally similar to modern method used today. Surgical instrumentation. He described over 120 surgical instruments, including scalpels, needles, forceps, and probes, many of which were designed to mimic the beaks or jaws of animals and birds for better grip and precision. Cataract surgery. He is credited with performing the first coughing surgeries where a curved needle was used to displace the lens and restore vision. Advanced procedures. His work details procedures for kidney stone removal, that is lithotomy, fractures, hernia repair, and even brain surgery. Antiseptic and anesthesia. He used wine as an early form of anesthesia and emphasized the sterilization of instruments and wounds using the fumes of medical herbs. Well, educational innovation of Susutra was a firm believer that a surgeon must be both a theorist and a craftsman. He famously instructed his students to practice incisions and sutures on non-human objects before touching a patient, such as incision, practice on ground, watermelons, and cucumber. Probing, practiced on hollow bamboo or rotting wood. Bandaging, practiced on life-size cloth dolls. This text, Sushruta Samhita, is divided into 184 chapters and describes 1,120 illness, 700 medical plants, and 64 preparation from mineral sources. It remains a primary source for the study of Salya Tantra, surgical science. Alongside these important intersection between ancient literature and medicine, it is equally necessary to examine how different civilizations understood medicine in distinct ways, allowing for a more nuanced understanding of their relationship with literature, healing, and culture within medical humanities. Well, if we talk of father of medicine in different civilizations, well, Hippocrates is the most widely recognized father of medicine in the Western world. Different civilizations honor their own foundational figures for establishing medicine as a scientific or systematic discipline. So these include the father by tradition Western medicine, Hippocrates, of course, 460 to 370 BC is credited with separating medicine from superstition and religion. He introduced the Hippocratic oath and the theory of the four humors. Indian medicine, Ayurveda. Charaka, that is 300 BC, is known as the father of Indian medicine for compiling the Charaka Samhita, an ancient encyclopedia on internal medicine and lifestyle. Chinese medicine, Shenong, the divine farmer, is venerated as the father of Chinese medicine for discovering and testing hundreds of medicinal herbs. Zhang, Zhujiang is also sometimes called the Hippocrates of China. Islamic Arabic medicine, Avicenna Ibn Sina is often called the father of early modern medicine for his work the canon of medicine, which influenced both the Islamic world and Europe for centuries. So, father of a specialized medicine, that is surgery, Susutra, ancient India 600 BC, is the father of surgery and plastic surgery, and that we already discussed. Anatomy, Herophilus, ancient Greece, is the father of anatomy for being the first to systematically dissect human body. Molecular medicine, Asclepiades of Bithynia, ancient Greece, is honored as the father of molecular medicine. Well, ancient medical systems were built on comprehensive texts that combined clinical observation and foundational theories of bodily balance. These systems shifted the understanding of illness from supernatural punishment to natural environment driven process. So, the core medical theories are the ancient medicine, which was dominated by the idea that health is a state of equilibrium between internal forces and external elements. Some of these core medical theories are theory of four humors, established in the Hippocrates corpus, and this theory poses that the body contains four fluid: blood, phlegm, yellow bile, and black bile, linked to the four elements air, water, fire, and earth. So, illness occurs when these humors become imbalanced. Then, three doshas theory, that is the part of Ayurveda. Found in the Charaka Samhita, health is maintained by balancing three doshas, bioenergies: Vata, movement, air; Pitta, metabolism, fire; and Kapha, structure, water. Yin, Yang, and Qi, traditional Chinese medicine TCM, focuses on the balance of yin yang opposing forces and the smooth flow of Qi, vital energy, through meridians in the body. Pancha Mahabhuta, the theory that everything, including the human body, is composed of five great elements: space, air, fire, water, and earth. Revolutionary practices of ancient literature, that is medicine, intersection, clinical observation. Hippocrates pioneered bedside medicine, emphasizing patient history and environmental factors like diet and water quality. Anatomical dissection, Sushruta insisted on the dissection of cadavers using water decomposition to peel layers to master anatomy before performing surgery. Surgical training students in ancient India practiced incision on ground cucumber and leather bags filled with water to gain precision. Preventive care, both the Charaka Samhitas and the Hippocratic text emphasized lifestyle medicine, including exercise and seasonal regimens, Ritucharya, as the first line of defense against disease. Furthermore, within the ancient Indian literature, medicine intersection, there is also the Mahamrityunjaya mantra, a powerful Vedic chant for healing, longevity, and protection against untimely death, often used to complement medical treatments for severe illness. It is believed to generate immense positive energy and mental fortitude to aid recovery. In Ayurveda, a specific potent herbal formulation known as Mahamrityunjaya Rasa is used to treat chronic fever, neurological weakness, and illness. So let us see the key aspects of Mahamrityunjaya and health. Spiritual healing. Often the mantra is chanted 108 times using a Rudraksha mala to invoke Lord Shiva's energy for rejuvenation and overcoming death-like health crisis. Mental and physical benefit. The vibration of the mantra is said to induce peace, reduce stress, and strengthen the immune system. Scientific study. Researchers, including those from AIIMS and RML Hospital, have studied the impact of this mantra on patients with severe brain injuries, traumatic brain injury, to measure its effect on reducing psychological stress and improving outcome. So, some other essential components of Mahamrityunjaya Rasa Ayurvedic medicine include ingredients of this Ayurvedic medicine, and it contains purified hingula, cinnabar, gandhak, sulfur, basant nava, acontinum ferox, and piperine compound like kali mirch and pipli. Uses Used for treating high temperature, chronic fever, post-viral fatigue, and neurological disorders. Precautions: as it contains mercury and aconite compound, it must be taken under strict supervision by an Ayurvedic physician. Thus, through the discussion in this lecture, we can deduce that there are various components within the intersection between literature and medicine. So, some of them include medical fiction. These works explore issues such as aging, cognitive differences, and physical disability through storytelling. Literature by physician authors with medical background like Anton Chekhov, William Carlo Williams bridge the gap between scientific medicine and humanistic understanding. Genre variety includes medical memoirs, case histories, short stories, and graphic medicine, graphic novel, which provide diverse perspectives on patient care. Genre variety refers to the diverse categories of artistic, literary, or musical works, ranging from fiction, romance, fantasy, to non-fiction, memoir, history, and Western. Shared elements like content, style, tone, or medium define these categories, and these includes literature, common genre including romance, fantasy, memoir, young adult, true crime, science fiction, and thriller. Then film and TV. Types range from scripted narratives like action, comedy, and horror to unscripted formats and westerns. Music encompasses varied styles such as classical, jazz, and rock. Purpose of genre variety. The variety enables a specific audience expectations to be met, providing a recipe or framework for creators. One of the major benefits of genre variety within medical humanities is that engaging with different genre is likened to training different mental muscles, as each genre requires different cognitive skills. 5 broad goals by including the study of literature in medical education. Our literary accounts of illness can teach physicians concrete and powerful lessons about the lives of sick people. Great works of fiction about medicine enable physicians to recognize the power and implications of what they do. Through the study of narrative, the physician can better understand patients' stories of sickness and their stake in medical practice. Literary study contributes to physician expertise in narrative ethics. Literary theory offers new perspective on the work and the genre of medicine. Some other core goals include fostering empathy, promotes a patient-centered approach that balances technical medicine with kindness. Critique and advocacy evaluates how power dynamics, social injustice, and commercialization affect health and access to care. Reducing isolation allows readers and patients to feel less isolated, forming communities and new forms of understanding. Exploring personhood uses literature to explore the meaning of being human, particularly when facing disease or decline. Particular texts and methods are well suited to the fulfillment of each of these goals. Chosen from the traditional literary canon and from among the works of contemporary and culturally diverse writer, novels, short stories, poetry, and drama can convey both the concrete particularity and the metaphorical richness of the predicament of sick people and the challenges and rewards offered to their physician. With this, I conclude the discussion, and we shall meet with a new topic in the next lecture. Till then, thank you.